a program where we kind of look at challenges in our community and bring in guests to talk about some of the solutions to those challenges. And so my guest this morning on our program is Dr. Bob Underwood from San Juan Regional Medical Center. He is the Chief Medical Officer at the hospital. Dr. Underwood, good morning and welcome back to KSJE.
Good morning, Scott. It's good to be on again.
Nice to have you back. You're in the studio. You're not on the phone. You're not some disembodied photo that I'm talking to.
Absolutely. And unfortunately, this is the first time we were talking about it before we started that I've been on, and we're not talking about the impacts of COVID. So
right.
This is really refreshing.
Unless you want to.
Great news.
Let's talk about something else.
I still can because I still research.
I know you can, yes, sir. But it's nice to have you here to talk about this topic, which is really exciting. And it fits into our format of our show, the Solutions from the Street program.
Right.
We talk about, the limitations of primary care physicians in communities, not just in San Juan County or New Mexico, but all across the country. And what has happened is San Juan Regional Medical Center has been awarded a pretty substantial grant to start a primary care physician residency program. And that sounds very exciting. Sounds like it's a lot of work and may take some time, but I think that's kind of the light at the end of the tunnel, right?
It absolutely is. This aligns with the strategy of the organization. And yes, you're exactly right. This is a big step in the right direction. It will be a long time coming to fruition. But the intent is that in most residency programs, especially those that are primary care, the folks who finish that training stay where they did their training. And yes, we have a need for primary care providers right here in San Juan County and in the Four Corners area. And so the long-term strategy is we will start to build that cadre right here in Farmington, right at San Juan Regional Medical Center.
Nice. And so this grant comes from the state, the HSD.
HSD, yep.
And it is kind of just a get started grant type of thing. And so now the work begins to kind of develop this program?
So what we will do is reapply for the grant every year. So this one is the first year just to get it off the ground. And so that is bringing in the appropriate personnel, reviewing the requirements for the various types of primary care specialties. That's why we only call it primary care.
Right.
There are a couple of specialties that fit in the primary care definition. Most likely will be their family practice or internal medicine, but there are requirements you have to have. Certain type of faculty members, they have to do certain things. They have to provide a certain level of care in order to qualify for a training program. And so that's our investigation, understanding what that curriculum really needs to be, and bringing in who's going to be a medical director, needs to be a physician, and bringing in a coordinator because from what you've already heard, you could tell that there's a lot of pieces that need to be coordinated.
Right.
And that position is probably going to be even bigger than just the residency program. The reason I bring that up is we do a lot of training at our hospital already. This is really, and what we talked about at our strategy retreat last year is formalizing our educational programs for practitioners, that's licensed independent practitioners, which includes PAs, nurse practitioners, CRNAs, nurse anesthetists, and physicians in training, whether they're students or residents. This particular one is probably the biggest piece, the residency program. But we really want to formalize and consolidate how we do that training for all of the providers in our community.
Nice. And so remind me and our audiences a little bit about how a residency kind of fits into the whole education of a new doctor, right?
Yep. The way a physician is trained, you have to, of course, go to college, generally do pretty well at college, and then after college, you go to medical school, and medical school is generally 4 years in and of itself. 2 years that they call the basic sciences. If you've done science, you realize quickly that's not really basic science anymore. You're pretty advanced anatomy, physiology, pharmacology, things like that. And then after your 2 years of sciences, then you do 2 years of clinical rotations. And those are your clinical years of medical school. And then sometime towards the end of your third year, beginning of your fourth, you decide what specialty you want to go in. I'm an emergency physician. And so from that, you choose residencies that you will apply for. And then you get accepted into the residency of your choice, hopefully. And from that, you do another 3 to 7 years of training as a resident or a fellow before you're fully licensed and board certified within that specialty.
Gotcha. And so this program would be that
It
4
would
to
be
7 year.
It would be a 3-year
time period? 3
program
years.
after medical school.
I see.
That's correct.
And so and then with your hope that these folks, once they're done, would stay in the community and start up a practice.
Exactly. Either one of the many practices that we have in town, or stay at San Juan Regional Medical Center. We have a number of practices that are part of San Juan Health Partners. And so we have numerous opportunity selections for primary care in our community. As we talked about, it's a need, certainly here in the Four Corners area, but really nationally.
And so with this residency program, is there a shortage of places where these students can go? And is there a competition, I guess, to try to attract these students to be a resident here rather than over there?
There certainly is. And that'll be part of developing this program is to make it attractive for those medical school graduates to want to come here to do their training. We've already had an interest. I mean, there are youth from our community who are currently somewhere in that pathway. They're either in college or they're in med school and they want to come back. And so they're very interested in us having a residency program.
And I guess that's pardon me for interrupting, but I guess that's part of the whole idea of maybe trying to grow your own and folks who grew up here, who maybe have ties here, who want to stay here,
You bet.
to be able to be a resident here. I mean, that checks a lot of boxes for some folks.
It does. Yeah, it really does. The other benefit, and I have to explain this to folks, for people who are unfamiliar with Farmington, we have one of the things that you want in your training is a high level of acuity. You want to see a lot of different disease processes. You want to, because that's how you learn.
Right.
And what people don't understand, we do because we live here, is we have that here. Most people who are not from Farmington don't understand that we're kind of a bigger city in a corner of a very open state.
Right.
And so we have a very active hospital with very active patient care ongoing. It is a wonderful opportunity for residents and medical students and anybody in that continuum to learn about the care of patients. And so that's going to be a big draw for us to get those caregivers to come here, those physicians in residency. The last hospital I worked at in another town was much smaller than San Juan Regional Medical Center, and we had a 24 residents at a time, so 8 per year at that hospital. We're bigger than that. We have more patients and more opportunities to learn than even that small hospital did. So I think we will attract residents to want to come here and learn.
What's the number that you're hoping to see maybe as this gets up and running?
Initially, we think we're going to just start with 4 residents and then evolve to 6. That's probably where we're going to go. Again, we don't have to declare that just yet, but we think that it'll definitely support that number of residents to come through our program. Part of it is making sure that we're doing everything right as we ramp up rather than try to go big bang out of
right out the gate.
Yeah,
exactly.
Yeah.
And for your current physicians, I mean, do they then have an opportunity to teach these newbies that are coming in, these fresh-faced physicians that are ready to go and don't know what awaits them?
Absolutely, and you're right, they don't. We all get our eyes opened at some time or another.
I bet,
yes. But yeah, that has been one of the really exciting things, Scott, is that as we have this has grown and we were applying for the grant and we were publicizing and talking about it with physicians. I have had physicians from almost every specialty at our hospital say they want to be part of it, that they want to teach, they want to bring the residents through their departments. And that's one of the things with primary care. Almost all primary care residencies, you get a broad exposure to various specialties. So family practice, especially, you'll do a rotation on general surgery, and you'll do a rotation in OBGYN, and you'll do pediatrics, and you'll do emergency medicine. And so it gives an opportunity for many of our physicians on staff to have that opportunity to interact.
Nice. And I guess a good opportunity for these students too, right? To learn
Yes.
about all these different specialties as well as they get into that field.
Absolutely. It's kind of a colloquialism, but one of the things that we say about primary care, emergency medicine too, which is mine, is that I have an ocean of knowledge, but it's only ankle deep. The point of being is I have to have a broad exposure to all kinds of things because you don't know necessarily what that next patient is going to bring with them when they come through the door.
Right. Well, and that's the idea. And it might be multiple things that they bring with them, right? That
They
you have
do.
to then send them to different specialists
Absolutely.
to figure out exactly what the course of treatment would be.
Yep.
This is very exciting. My guest this morning, Dr. Bob Underwood, is here. He's the Chief Medical Officer, of course, for San Juan Regional Medical Center. And we were talking about the brand new, just announced, primary care physician, residency program at San Juan Regional Medical Center. This has not been done here before, in my understanding.
That is correct. My understanding is before I got here, which is almost 6 years now, that they had looked at it a couple of times, but it never really got off the ground. And so, our great opportunity is that we're getting this grant from HSD. And it's specifically designed to run primary care residency programs within the state of New Mexico. So it's working with HSD and the New Mexico Primary Care Training Consortium. It has an acronym. I have a hard time saying it, but they're the ones that I've been working with very, very closely to talk about, okay, what's the curriculum need to look like? What are the check boxes we need to have? And so they've been wonderful partners for us in development of this so far.
Very exciting. Well, and again, the idea being to recruit these students who will come here, do their residency here, and hopefully stay here, and then serve the community as a new primary care physician.
Absolutely.
And that's the idea. Now, prior to this, I guess, would most folks maybe go to UNM, or where would the residency programs be?
And so the med schools that we will recruit from, usually you're recruiting a lot within your state, and so it'll be Burrell College, which is the osteopathic medical school, and UNM. But we'll also reach out to other regional medical schools. In fact, it'll probably be a nationwide outreach to see who would be interested in coming here and learning within our community.
Certainly no limitations, right? I mean, you would accept a physician or a student from anywhere if they want to be here.
That is true.
And you have room.
Within any USMLE, so United States Medical Licensing Exam, and so U.S. schools mostly.
Right.
But there will still be opportunity even for foreign medical graduates to qualify to do a residency at our program as well.
Got you. And so the timeline would be, again, as you ramp up this program,
we're thinking 2 years, maybe 3 from now. And as I have spoken to the folks at the state, they be conservative about it and try not to do more than we need to. There's a whole series, of course, of accreditations that we have to qualify for as well before we can start bringing residents in and remain qualified, so that as our residents graduate, they've graduated from a certified program, and that they can get their full medical license and residency or specialty training certificates.
Gotcha.
So they need to be board certified when they finish our program.
I see. And so 3 years is kind of the conservative view of what you're looking at, maybe to ramp up here.
Yep.
And as you said, this grant is you apply every year?
Annually, yes. And so what we'll do is we'll get we have a work list that we're working through, and as we get towards the end of it next spring, we'll reapply for the next year's grant, which will probably be more things that need to be done as we work closer and closer towards our actual launch date.
Nice.
So.
And this is something new from the state, is it not? Or has this program been going on, these grants have been given out before?
I have to say that this is, they have given some grants out before, but this is a newer program, primarily brought forward by the governor. It really is fortuitous. We had a strategic retreat last fall, late last summer, where it was our board of directors, physician leaders from the community, the leadership team of the hospital, talk about what we wanted to do, and this was one of the things that came up. Fast forward, I'm at the New Mexico Medical Society meeting in Albuquerque, and Dr. Scrace and some of the folks in his team get up and they talk about this new primary care training consortium grant. that they're going to be bringing forward. So I approached them as soon as the meeting was over, say, this is a direction we want to go. And it's just kind of taken its own wings since then.
Interesting.
Yeah.
Very, very cool. Well,
Yeah.
and I think that has been a conversation at the hospital level
Yeah.
for a while to try to figure out how to, again, grow your own, or how do we
Right.
train our folks that maybe want to stay here
Right.
and serve the community, because we do see a shortage of primary care physicians.
Yeah, and so we every 3 years, a not-for-profit organization like ours has to do a community needs assessment, and we just finished that. The number one need in our community is access to care, and so that was done after we were already on this plan, but it reinforces how important this is to do within San Juan County. You know, there's tons of other benefits. It'll bring in academics really to the forefront of our organization. When you need to teach something, I think you're at the top of your game anyway. So I think it's going to even drive the quality of care of our organization up even higher. It will open practices within our community. It's going to be a financial benefit to the community as a whole. It creates jobs. And when businesses look whether or not they want to move to a particular community, they look at what is the healthcare infrastructure in that community. Can they support your employees? And so all of those things are bolstered by having a residency program.
Nice, very
Yeah.
good. And I guess, again, from the state to recognize, I guess, the problem of not having enough
Yes.
primary care physicians in some of these rural, smaller communities, not necessarily rural, but we're
Right.
certainly not as big as Albuquerque or,
No.
or Las Cruces. But to send money out in these grants, I imagine San Juan isn't the only hospital to benefit from this grant program. Are there
that
others
is-
around the state?
That is true. There are a couple of other programs that are being developed and maybe farther down the pathway than we are. Hispaniola, I think, is one of those, and we're learning from. That's the benefit, is we're learning from what they've done as
Right.
well. It's like, okay, well, what were the roadblocks? What were the hurdles that you ran into, so that we can make sure we've mitigated those impacts before they happen.
Right.
Yeah.
Very, very exciting. Might we see a San Juan College Medical School?
You know, that
Or
would
leave
be,
that for the other folks?
that would be a dream. It would be a lot of fun, but yeah, we're probably not there yet.
Okay, all right. Are there some opportunities maybe for the college to help in this regard, do you think? Or is this more of a hospital-centric thing, program?
There will be, and that's because, as you know, healthcare is a team sport. Yes, we may have the residents, and we may be training with the residents, but there are nurses, respiratory therapists, x-ray techs, physical therapists, all of those other disciplines, and many of them are trained right here at San Juan College.
True,
Yeah.
very true. And so that will help for those
Yeah.
careers in the future too, I imagine. If you've got
Yes.
more physicians in the community, you need more of those folks.
Absolutely, and if you train together, I think that you learn your discipline together, you respect each other, and you deliver care better farther down the road.
Very, very exciting.
Yeah.
And so what does this mean? This just means more work for you, Dr. Underwood, or do you have some other folks you're going to be hiring to help out with some of this stuff?
We will be. Currently, it is, and that's okay. This is something that's really exciting. Like we said at the beginning of the
Yes.
program, it's something that is very promising for the future. It's not trying to deal with a pandemic. It is really building something that's really going to be meaningful for our community, for our hospital, for our community of healthcare givers at San Juan Regional and all over the place. So that's a big benefit. That's why it's not, yes, it's work, but it's all fun to do. But we will be hiring. In fact, I'm in the process of doing two what we call purpose descriptions, job descriptions, that will be the initiation of the cadre that will be part of this program.
Got you. And it sounds like to me this has some regional impacts as well. I mean, you certainly hope some of these folks would stay in Farmington, but I imagine some of the other regional hospitals might see the benefits as well.
Oh, absolutely. Absolutely, that will be true. And like I said, some of them will stay right here in our own community, but some of them will venture out. And then another benefit is, as they go to other communities, they improve the health in those communities, whether it's Cortez, Shiprock, or something else within our region. But it may be that they go back to another academic institution, and then they can be promoting, you know, where I did my residency? I did it in Farmington, New Mexico, and this is a community you need to check out.
There you go.
Yeah.
And you mentioned all the different types of experiences that these students would have
Yeah.
here, because it's somewhat of a unique medical hub, if you will,
It is.
for the residents who live in the entire region. And we've seen that folks will travel here for specialized care.
Right.
They don't have to go further to Albuquerque or Denver for those types of things. And that's being offered here. And that gives those students, I guess, exposure to some of these procedures.
Absolutely, it does. And that was over the 5 years that I've been here. As we can expand anything that we can provide to our local population, that's exactly what it does. It keeps them from having to go to Albuquerque, sometimes Phoenix, even as far away as Salt Lake or Denver to get care. If we can provide that here, and impact the fact that they don't have to be separated from family and away from their home to get that kind of care. When you're in the process of getting major medical care, it's stressful. It's stressful to families. And so if you can do that at home, all the better.
Long-ranging impacts from what we're talking about here this morning is what I'm hearing.
Yes, it will be big. And that's why we're so excited about it. It sounds like, okay, so we're going to have a couple of new doctors every year, but the ripple effect that it will have on our community is going to be huge.
Right. And would it be, I guess, once it's up and running, not too difficult to expand it if you're getting a lot of demand, a lot of interest from students and things like that, once you have all those core things in place?
So yes, that will be an opportunity as well. It's really interesting. There's a lot of federal guidelines that limit how much you can do and how fast that you can do it. But yes, we will.
And I'm sure it costs money.
They do, but it's an investment, and
right.
That is very, very important. But it might start off with a couple of residents, expand that program, and then we'll look and see, are there opportunities to move into any other specialties and specialty training, whether it be emergency medicine, surgery, those types of things.
Gotcha. Cardiology, I guess, or things like that, or not so much?
So cardiology is actually not a residency, it's a fellowship. So you have to, remember I talked through the plan?
This is why I'm not a doctor.
Yeah.
See?
So in order to do cardiology, you have to do a 3-year residency program and then apply for a fellowship of another couple of years in order to be a cardiologist. And the length of that depends on what kind of cardiologist you're going to be.
Okay.
Yeah, so it's pretty in-depth.
Right.
Yes.
Understood. But is that something, I guess, that the hospital could also offer then down the road, that once they're done with the residency, there could be a fellowship here in some of these things?
Yes, it would be a possibility down the road. Again, I look at places where I've worked that were about the same size or maybe even smaller. And there was an intensive care fellowship in the sister hospital in the town that I used to work in.
Okay.
And it was not as big as we are.
Gotcha. So this opens a lot of doors, I guess, is what I'm hearing.
Yeah.
Depending on how things grow.
Yes, absolutely. And we're recruiting physicians all the time.
Yes.
To come into our community, depending on what our needs are. This is something else that as we're recruiting physicians, we can say, we've got a residency program, and it will attract a different cadre of physicians who want to come and who want to teach. They'll bring with them their own expertise in those various areas, and then that expands once they're here.
Nice. And so I know that's an ongoing challenge for not just San Juan Regional, but other hospitals as well, to recruit quality doctors, physicians, specialists to the area when you have an opening.
Yeah, absolutely, it is. Recruiting is a big piece of what we have to do. And we want to bring in great doctors to take care of our community. And some specialties more difficult to recruit than others, and it changes from time to time. But this will give us, as we said earlier, primary care is one of those that's very difficult to recruit. And so bringing them in, it'll open that so that we have a greater ability to recruit and give offerings. Some physicians, wherever they're working or when they're coming out of their training, they have an inclination to teach. And if we don't even have that as an opportunity here, we're not going to attract that candidate. So this expands our offering for a number of different candidates to come here and want to work in our community.
Right, and hopefully stay.
And stay.
Right,
yes.
Very good. Win-win-win.
Yes, I really do. There's not very many things that you work on that you just keep seeing the positives about it. And honestly, the residency program, and to be able to develop that, I really, that's all I see when I look at it.
Very exciting.
Yeah.
Thank you for sharing that with us this morning, Dr.
Yeah.
Underwood. We're
Glad to
really
be on.
excited to be able to share this with the community, with our
Right.
audiences. I know, it's a long range look, but 5 years from now,
We'll have.
you'll be up and running, we hope.
We will be up and running either in 5 years. We will have either graduated our first class or they will be in their very last year of training.
Okay.
Yeah.
Can't wait.
Yeah.
We'll see. Very good, sir. Thank you for being here.
Thanks, Scott. I appreciate it.
You bet.
Yeah.
Always